afternoons are rough for them. So, all right. Well, hello, everyone. Welcome to our next Sit and Sip series with Sam session. And our guest speaker today is Sean Sibley. And instead of me, totally butchering his introduction, I'm going to have him do it because he's going to do a much better job of that. So, Sean, if you want to just kind of introduce yourself and tell us a little bit about your career path and kind of what you're doing right now.
Thanks, Sam. Yeah. So my name is Sean Sibley, and I currently work as a nurse practitioner at Cutler Health Center, which is a Northern Light Eastern Maine Medical Center primary care practice. So that's my full-time job. And then I'm also a part-time lecturer in the School of Nursing here at the university. So how did I end up here? I graduated high school and knew I wanted to go into health professions. I just didn't really know what that looked like. I just knew I wanted to help people and I could do science. So I thought it was a good fit. And with the help of my guidance counselors, they actually pursued me or encouraged me to pursue nursing as the career path. As compared to maybe going like a different route with doing a degree with a focus in pre-med or something like that. So anyway, I just kind of fell into it is what I'm trying to say. And so I got involved in the nursing curriculum here at the university, and I also studied theater. I have a minor in theater, and
Oh, you're doing great.
I'll just continue. Well,
Yeah,
Nick
keep
was joining,
going.
and so
Oh, I know.
okay.
Hello, Nick. Look at that fancy photo. He's just
So
like,
yeah. So that's what I did here, and during my time, when I was studying nursing here, I had the opportunity to work in the Career Center, which was great. And I was involved on campus. And I think just having multiple or doing things that interest you is important to be well-rounded. And yeah, so when I had the opportunity in the curriculum to become a CNA, I pursued employment in that capacity. And so I started working in the intensive care unit at Eastern Maine Medical Center as a CNA, kind of unit secretary type job, just per diem, something to get some experience. And then working in that unit allowed me to apply for my senior partnership there in the intensive care unit. And that's where I started my work as a registered nurse. So I started off in the intensive care unit, and that's where I practiced while I was earning my master's degree with a focus in being a family nurse practitioner. So my clinical background's in critical care nursing, and then I started in family medicine almost 2 years ago as a nurse practitioner, and I've always worked right here at Cutler. So that's kind of my path. Is that what you were looking for, Sam?
yeah, no, that was perfect. Now, I am sure Heather and Nick are just as intrigued about the possible answer to this question as I am. So how is COVID-19 affecting your role, affecting the work at Cutler Health Center? And like, what is your typical day looking like right now with COVID-19 and all this?
Sure. So with being an employee of Eastern Maine Medical Center as kind of, I don't know the technical term, but basically in states of emergency or disaster, it is, it goes into an emergency response situation. And so we've been in that state for a long time now, and it just means that we kind of function differently. And I think and another thing that comes along with that is making sure that all staff are on standby to help wherever needed. So and we're adapting to this situation. But what it looks like is because of the contagiousness of COVID-19, family practices, like, that elective surgeries have been put on hold. Pretty much anything elective or preventative is on hold right now. And so family practice settings are only seeing patients that are acutely ill or injured, and obviously continuing to manage primary care patients, but at a distance. So ideally, anybody with respiratory symptoms, a fever, anything of concern that could be like a COVID-19 potential case is going to an alternative site for evaluation if they meet certain screening criteria on these hotlines that are set up. So anyway, long story short, basically, I would see a lot of respiratory illnesses here in the clinic, and it's encouraged that they go through this other channel now through the organization. So what my day looks like is still managing our primary care patients, so chronic disease type stuff, medication management, following up through telemedicine, because a lot of regulations were changed to allow this to happen quickly in the state of emergency, and with social distancing being important. People can come to the office if the provider deems it necessary for evaluation. So it's not that people can't seek care, it's just that we're very careful in triaging who we're potentially bringing into the office for exposure. And our staff has been kind of staggered as well. So we're taking turns being here in the clinic and then working remotely at home, so that in the event of an exposure, our staff is able to swap out. And then also, I'm available for deployment within my organization, and we all are based on our past experiences. So in the event that there's a surge somewhere in the system and I meet the qualifications to go work in that area, then I can be asked to deploy to that area. So for me, it could mean going and working in the intensive care unit again, or working with another team of providers at the hospital to do something within my scope of practice. But that's kind of what things are like day to day.
Awesome. Heather or Nick, do you guys have any questions for Sean before I just keep on asking him questions? Anything? Oh, Heather?
Okay, here I am.
Yeah.
I had a list, but I don't know where it is now.
Oh, that's okay.
So so at a family reunion last summer, I was talking with an aunt of mine who's a nurse practitioner in Connecticut. And she was asking me about my trajectory. I'm on the older side, so I'm trying to, and I've lost some time. So I'm trying to move pretty quickly, like with the end in mind. And I said, my end goal is to, do my MP, and I'm not sure. I'm kind of waiting to see. I have an idea of where my interests are, but I don't know that I want to go to critical care or know that I want to do women's health. Like, I'm just open. And so her response was, "Oh, aren't you worried that the market's going to be saturated?" And so that put a little bit of fear into me. And that was my question one of my questions was, what does the job market look like? I know it's impossible to predict right now, but just curious.
Oh, sure. So specifically for family nurse practitioners, is that where you're at? Yeah. One thing that's interesting is there's, a new consensus model, it's called, for advanced practice nursing, which very clearly delineates what your education is, determines what your scope is. And so that's been very strict in Maine recently. And so as far as family nurse practitioners go, a lot of it depends on where you want to be geographically. I think that in rural communities, there's a very high need, and a lot of those providers that I can think of, I'm thinking like Northern Maine, Western Maine, down east. A lot of the people that are practicing there are close to retirement. That's what I've noticed just from like hanging out with like at the Maine Nurse Practitioner Association events and whatnot. And so those areas, there's a high need. I think that in larger urban areas of Maine, right, like there are still job opportunities, but I have heard that it kind of waxes and wanes. I think there's a big surge of online programs that are, so people are becoming nurse practitioners at a higher volume than they were able to before with just brick and mortar places of education. And so that's been, I think, an interesting surge in producing nurse practitioners, in the family nurse practitioner in particular. I think there's a high need for psychiatric and mental health nurse practitioners. That's in high demand. That's a known high or hot field, I guess, to get into. And similarly, I think that there would be a need for the acute care nurse practitioner. So those are NPs that are typically working in hospital-like settings with higher acuity patients. And I think that that's a need, and those programs in Maine specifically are limited. And so I think that's one reason that you don't have a lot hanging out in Maine. But I would say the market comes and goes, Heather, and it's totally fine to, I think it's good to look at job descriptions in particular to know, what makes a qualified candidate. And so you can, pursue that. And just, keep an eye on it. My job search was a couple of 2.5 years ago now. And I was able to have many opportunities in this area. Yeah.
Nick, do you have any questions? Or Heather, do you have any more questions before I can keep going? Hi, Nick.
I had one question. Sorry, I joined late. I've been
You're fine.
I've been getting your email, Samantha, in regarding to some of these meetings, but then I haven't had the chance to, and I'm glad I got the chance. But at first, when I joined, my sound was on because I'm actually doing 2 meetings at once, but I really wanted to get to this meeting too. So I'm like looking at this screen and like looking at the dictation. So I'm like going back and forth. But I do have a question for Sean. Mentioned the acute care nurse practitioner, and could you differentiate the difference between acute care and then family practice nurse practitioner? Because I thought more people would, it'd be more beneficial, I don't know, to be a family practice and then you could go into a hospital because you can care from pediatrics all the way up to end of life. But acute care, I think, based on my knowledge, is just adult. I'm not sure. I mean, Sean, you'll probably know more information about that, but could you maybe talk about that a little bit more, if you know?
Yeah, absolutely. So there's a population foci with advanced practice nurses. And so that's when you hear terms like adult, pediatric, family. That's like the population that you can care for based on your education. And then another delineation within that is acute versus primary. So really when you hear family nurse practitioner, it's really like a family primary care nurse practitioner. So the education is focused on caring for patients with, obviously, I don't know if I could say it well, but like preventative health and things you see in the office, and like the management of chronic disease and also diagnoses of acute disease and disorders. And then there's like this gray line that you cross over when the acuity becomes too high to manage it in the office, right? And that's when somebody who's acute care educated could take over, and vice versa. An acute care nurse practitioner, wouldn't just be doing routine physicals in the office. So for instance, if someone comes into the office and has what I assess to be an acute appendicitis, like I can't do anything else other than get that person to the next higher level of care. But I think one thing I would have you look at, Nick, is the APRN consensus model. And I don't know if you've, there's a nice just image that shows the APRN roles, the population foci, and then the specialty. So anyway, I think to answer your initial question, yes, family means you can care for the whole population, but in a primary care role.
Sean,
And a lot of times,
what was that website again? What was that website?
So it's through NCSBN, which is the National Council of State Boards of Nursing.
Okay.
And what I'm referring to is the consensus model, and meaning consensus model for regulation, licensure, accreditation, certification, and education. It's really it's a super complex situation, but they make a nice graphic and you can just read about it. And that helps you understand, okay, if this is my education, what might that look like in practice? And then the other thing I'd add is, so I know a UMaine grad who did an out-of-state program in, so she can sit for certification for adult acute nurse practitioner and family nurse practitioner. So you can do multiple programs and hold multiple certifications. I know a lot of people that are family nurse practitioners, but also psychiatric and mental health nurse practitioners. So you can have multiple certifications. Maintaining them becomes the bigger challenge, because with certification, in advanced practice nursing, in the state of Maine, registered nurses don't need continuing education to maintain licensure. With advanced practice nursing, and for each of your certifications, there's a lot of like hours that go into maintaining cert.
Does that no certification, well, no continued education for nurses, you said the state of Maine, does that include our compact that we have with the other states as well, or are they kind of a little different, or does that go under the umbrella of the compact?
Well, now that you mention that, I almost wonder if I'm behind in the times, and Maine might have added continuing education hours to the requirement. I don't know how that works with the compact that Maine has agreed to, but the Maine State Board of Nursing website does well to outline that. I haven't thought about that in a while. And in the state of Maine, I will always have to maintain my RN license to be an advanced practice nurse. And practice is totally designated by state government. So it varies state to state, including practice authority. In Maine, nurse practitioners have full practice authority, meaning that after 2 years of full-time supervision under someone who meets those qualifications to supervise you, in my case, it's the physician at my practice, then after those 2 years, you're free to practice independently. Anyway, good thoughts. Regulation.
Good questions, guys. Any other questions before I keep going? Okay, cool. So, Sean, I wanted to ask if you wanted to kind of share a little bit. Before all of this happened, there was a lot of talk about telehealth and telemedicine, about how that was starting to become utilized more across the country. And I think that this pandemic really jump-started that. And so I was wondering if you can kind of talk a little bit about how telehealth has started to be utilized in your work, and kind of talk a little bit about what that looks like, what telehealth is really all about.
Yeah, I have to be honest, I wouldn't say that I'm caught up on best practices, because it was kind of just like a run with it situation. Before, when there was a lot of regulation around it, it was kind of like, the patient had to be in a clinical setting. They couldn't just be at home. You had to be at a clinical setting. You couldn't be at home. Now I kind of see patients from home more easily. So what I know about it is it works pretty well. It works the same. It's nice to be able to have, you can do a lot of physical assessment with just a camera. I've looked at people's throats and diagnosed like conjunctivitis through telemedicine. It has its utility, I guess. And then obviously for a lot of things that just involve kind of subjective chalking back and forth, it's useful. But so anyway, Sam, I'm getting away from your initial question. I think, what do I know about it, or how does it work? It works pretty similarly. For me, patients get scheduled. It's a telehealth visit. Medical assistant or the nurse calls ahead of time, does an intake, gets a little bit of the situation, updates information that they would update anyway if they were here in the office. And then I just get on and see the patient. And if there is something that I need to evaluate, then we'll turn it into, if it's safe to do so, have them come into the office and do something, like if it's screening for strep throat or something else.
Awesome. Yeah. Cool. Great. So, all right. So we have about 9 minutes left of our little sit and sip session. And I know Sean is a busy guy, so we got to make sure we, can let him go back to his work. And so, Sean, if you have any, I'm assuming, Nick, are you a nursing student as well?
Yes, I am.
Okay. So, Sean, do you have any advice for, our two nursing students here, and also just any nursing students or pre-health students that may watch this afterwards on, how they can get the most out of their undergraduate experience to be prepared for a career in healthcare?
Yeah. So just to reiterate, you are how to make the most of the situation. Is that what you asked, Samantha?
Yeah, like how can they get
Oh,
so
okay.
how can they get the most
Gotcha.
out of? Yep.
I'm not a good multitasker. I was looking at something else. Okay, so these are my thoughts. Well, I think first and foremost is just to focus on a routine for you. I mean, and anybody watching this probably is actively engaged in academics, and that changed, and maybe new responsibilities were added, etc. And so obviously managing time is important, and then having routine I think is important too. And then once you get that all straightened out, work to support others. Obviously, in the state of a pandemic, your brain's going to switch into survival mode naturally, and it's going to feel uncomfortable. And so I think that recognizing that in yourself, and then supporting other people too, and helping them as they make adjustments. Social wellness is really important for overall wellness, and I think that if you can continue to stay engaged with folks, that's really important. Isolation, it can be detrimental, and just complete social isolation. And so work on remaining some level of self-care through socialization is what I would recommend. I think there are a lot of opportunities potentially in communities to volunteer as well. I think for folks that are unlicensed, they're feeling like, how can I help? And so I would look to those volunteer opportunities in communities. If it's, there are different Facebook groups that have been set up, and other like pop-up organizations or longstanding organizations that, it could mean checking on people, doing some sort of distribution or pickup drop off of food and other supplies for folks that are high vulnerability to be out in public, or are unable to do so. So I would look for those opportunities as well. And from kind of the academic side of things, I think it's a good opportunity for a real world case study in learning some epidemiology concepts. Just looking at disease transmission and kind of learning some of the science and the math behind epidemiology might be of interest. And that way you can be an informed consumer of information that's being put out, and then maybe also help translate that for other folks who aren't engaged in health sciences.
Sean, since you went through this exact, it probably looked much different when you went through it, but the University of Maine nursing program, do you have any advice if you were to do it over again, if you were to go back, if you were to change things, if you would have concentrated on certain things more or done things differently? Do you have any advice concerning that?
Mm-hmm. Oh, yeah. I would say definitely take the time to learn pathophysiology concepts and anatomy the first time around. Like really work on getting that foundation. That's one thing that I think I kind of breezed over and then realized, I kind of had to learn as I went. And then especially entering advanced practice, like it's important to have a strong foundation basically. And it was my years of practice as an RN that helped me build some of that back up before I pursued, this role as a nurse practitioner. So just like learn the basics, because everything builds off of that foundation. So that's one thing I would go back and tell myself is like, actually learn that. Because it's important, but it's overwhelming when you're in school and drinking from a fire hose of content, and you don't know how it's all applicable, but you're just getting all these like pieces, right? You have all your aminos, but where the protein's at. So yeah, that's one thing I would say. And it's just there are always opportunities there. If you're curious and you take risks, there are just things are going to happen. And so I think it's important to be, goal oriented and to have certain outcomes, but at the same time, accept opportunities as they present themselves. I never would have told you that I would start out working in the ICU and that critical care medicine was my dream. I had no idea, it just happened. And it was a really good experience. When I was in school to be an FNP, I had no idea what I was going to do. I was just doing it because it was an opportunity for me. And I knew that I could do advanced practice, and that's great. But I didn't know that I would be like working here focused on primary care, urgent care, and student health. It just like happens, right? The same with teaching and being a lecturer in the School of Nursing. That just fell into my lap as well. It means they're all just opportunities that by putting myself and my energy out there became available to me. And so I would say just put it out there and roll with it. It's my guidance on that. Who knows what the future holds for me, right? Maybe I'll be sitting in this exam room in 30 years. I don't know.
Awesome. Any other questions? Heather, do you have a question?
Trying to figure out how to unmute myself. Yeah, Nick, you asked the exact question that was like at the top of my mind. My other question, Sean, was about kind of the time span in your, like, when you left undergrad, did you know that you were going to be interested in graduate education? How long did you practice before you started taking your classes? And what are your thoughts? Like, I know that I have this timeline in my mind where I have to like hurry up and finish because I'm, getting older in my career, and I want to make sure that I can bring my education background kind of back around too. But I also don't want to move so fast that I miss really key pieces and experiences.
Sure. So for me, I had the opportunity to be a graduate assistant in the Career Center. And so with that, that's what sold me I immediately started taking graduate courses as soon as I got my bachelor's degree. And that's just because I had that opportunity available to me. I mean, otherwise, who knows what would have happened. But I took my time and went part-time. So I did my master's over 4 years while concurrently working as a nurse. And I didn't start any of like the real nurse practitioner type courses until I was 2 years into my RN career. I think that's pretty solid. That's the recommendation for most programs, is you have a couple of years of RN experience, because you're a generalist when you graduate a BSN program. And then you want to build practice, and you really do learn a lot in just a couple of years of RN practice. And this kind of makes me think too, to our folks, that are pursuing other health professions. It is good to go and get some experience, and then it might change your mind about what you're into. I mean, it could change your entire trajectory. So the more experience, the better, even if it's short term, even if it's just shadowing someone like one time. I mean, you don't know until you know. So you got to see it. You got to explore. Right, Samantha?
Absolutely. I was going to say ditto. I totally agree on all of that stuff. You can tell he worked in the Career Center for a significant long time. That's why he's such a great resource. Awesome. So it is officially 4:30. So thank you guys so much for attending. And Sean, thank you so much for taking time out of your super busy, not really sure what's going on schedule. And so greatly appreciate that and all of that awesome knowledge you just shared. So this is recorded, so I can also share this with you, Heather and Nick, if you guys want to be able to look at it afterwards. And again, thank you all so much. Stay safe and healthy and all that great stuff, and we'll get back to normal at some point. I'm just sure of it. So have a great rest of your day, everybody.
Awesome. Thank you so
Thank
much.
you.
Bye, guys.
Thank you.
Bye, guys.
See you. Bye-bye.